What about splinting? Well, if we think about splinting, again, the indications are for mild to moderate carpal tunnel syndrome. There appears to be little to no benefit in the short term, so less than 3 months, versus no splinting. So if you're using splinting in the short term, you're not going to see any effect versus doing no splinting. However, it appears that splinting for 12 weeks might be better than 6 weeks. Also, it appears 6 months of splinting may be better than 6 weeks. So, very interesting this. So if you splint for the first 3 months, you might not see the best effects versus doing nothing. And in fact, if you have it for 6 weeks and whether you have it for 12 weeks, you're not going to see any difference between 12 to 6 weeks. So up to the first 3 months, you may not actually see much improvement. However, if you do it for 6 months, and there's low certainty evidence, by the way, so it's not nailed on, you might see better results than doing for 6 weeks and obviously doing it also for 12 weeks. So one of the things that we might need to consider there, which is not great really, is that we need to be preparing somebody, if they're going to wear a splint, for the long term. It appears also that wearing splints might decrease the likelihood of surgery. There's uncertainty whether it is best to wear splints all the time or at night. But it does appear that if you wear nighttime splinting, there's a bit of a question mark, yeah? There might be improvement in the short term versus no splinting. Wearing it at night might even be better because obviously, we also know that at night sometimes you might get increased symptoms.